So, ladies and gentlemen, we are back in our forum session. So, we invite everybody to come back into the auditorium because we're going to start soon. And we also like to invite all the panelists to be here with us. Dr. Alex, Dr. Maizatul, and Dr. Munyama. For those who are already inside the auditorium, you may scan the QR code above. This is the feedback form, is it? Feedback form. Okay, for everyone's information, our forum session this morning is going to be broadcasted live on YouTube channel. So, if you may, everybody can follow.
So sorry, Doctor. Sorry.
Nama Ubey. And N-U-B-E-Y. This actually, I have to give credit. This actually belongs to Sister Dana. Sister Dana is one of the Sarawak YouTuber. So, can follow the YouTube channel.
Cuba dia bisa live ke dia? Boleh ke?
Their Mikolog, I think. Maybe the committee can call the participant to come in to get into the hall. And also, one of our speakers, one of our panelists are also still not here. So we give them some time. Maybe the IT people can play some music first to kurangkan sikit nervous kita kat atas ni. Kita tiga nervous ni. Yeah, we're going to start our conference soon. Again, we'd like to announce to everyone that this forum will be broadcasted. I think it's already on. Is it? It's already on? Ada dekat atas? Oh, ada dekat atas. Oh, belum. Okay, it's going to be broadcasted live on YouTube. Yeah, that is the YouTube, Nana Ube YouTube channel. Can follow the channel. Yeah, we're giving credit to Sister Diana. Let us see Sister Diana, come show yourself, Sister Diana. Sister Diana is one of our Sarawak YouTuber. So lots of contents in her YouTube channel. You can just support her and can share the link to your friends back home to watch our forum. So we give it another minute. Tunggu Nisa, she's still tarik nafas lagi ya. Baru balik. Alright, we're going to start soon. We ready? Is already on? Yeah. Alright everyone, Assalamualaikum, salam sejahtera, salam Malaysia Madani, salam Sarawakku sayang, segulai sejalai. Oh! Welcome all to our forum session of the Borneo Lean Healthcare Conference 2024, brought to you from Pustaka Negeri Sarawak Midi Auditorium. And we are here today gathering in this glorious morning with a very comprehensive and inclusive event, joined together by our esteemed panelists on my right, who are masters in this field to discuss and dig deeper in our topic of today's forum. So the title for our forum today is Patient-Centered Lean Practices, How Lean Can Improve Patient Experiences and Outcomes. Let me do some introduction for this topic. In today's rapidly evolving healthcare landscape, the focus on patient-centered care has never been more critical. Patient-centered care emphasizes the importance of treating patients as active participants in their healthcare journey, addressing not only their clinical needs but also their emotional, social and informational requirements. This approach has been shown to enhance patient satisfaction, improve health outcomes and foster a more holistic healthcare experience. At the same time, the methodology originally developed in the manufacturing sector has made significant inroads into healthcare. Lean focuses on maximizing value while minimizing waste, creating more efficient processes and improving overall quality of care. By applying Lean principles, healthcare organizations can streamline operations, reduce waiting times, and enhance communication, ultimately leading to better patient experiences. Ladies and gentlemen, this forum aims to explore the intersection of Lean practices and patient-centered care. We will discuss how Lean can be effectively integrated into healthcare settings to not only improve operational efficiency and also to enhance the patient experience and health outcomes. Through sharing insights, experiences, and case studies, we hope to inspire collaboration and innovation in the pursuit of truly patient-centered care. As we delve into this topic, we invite you to reflect on your own experiences with Lean in healthcare, consider the challenges and opportunities ahead, and engage in discussions and can drive meaningful change in our organization. So that is our introduction for the topic today. And ladies and gentlemen, now that we've gone through the introduction of the topic, first of all, I think it is proper for me to introduce myself again to all of you. My name is Imrawati Wasli and I serve as a nurse in KKM for a rightful duration of only 20 years, and I'm currently working in the transfusion unit, blood bank in Hospital Miri. Well, enough about me. There's not so much introduction about me actually. I trust we are all more eager to proceed and finally engage with our esteemed panelists today. And we shall begin with our first panelist. He is an individual who is truly a leader and an expert in his field, possessing an impressive background, I can say, particularly in the area of patient safety within healthcare. He holds a Sarjana Perubatan MD from University Science of Malaysia, Master Degree in Healthcare Administration from Nagoya University, Japan, professional involvement in technical writing, innovation, research and journal publications at both national and international scales. He is a presenter, a panelist, and moderator to several forums and conferences, a dedicated mentor, I can say, of Patient Safety Champion, currently holds a position as Timbalan Pengarah Perubatan Kedua Hospital Umum Sarawak. It is a privilege to present and extend a warm welcome to Dr. Alex Kim Ranjan. Please join me in giving Dr. Alex a hearty round of applause. Hello, Dr. Alex. Are you ready for this? Ready? You hope so. All right. Never mind. Before that, I will introduce you to the next panelist. Actually, we met her yesterday in her plenary sessions already. She's a Senior Principal Assistant Director or Head of the Hospital Governance Subunit and Medical Development Division of Ministry of Health Malaysia since 2012. Develop framework and execute comprehensive strategies pertaining to MOH initiatives, namely cluster hospital and lean healthcare initiatives among others. Also develop training modules for staff and lean champions, managers and cluster hospital licensed officers. She's a lead, a mentor, and manage a high-performing subunit, fostering a collaborative and results-driven work environment. I'm beyond happy to reintroduce and welcome you today, Doctor. Let us welcome Dr. Maizatul Izyami binti Kayat. And to our third panelist who is joining us today, we are really glad to have you today. She is the medical officer at the Institute of Health Management, National Institutes of Health since 2019, a lean champion 2018, an MOH and University Kuala Lumpur, UniKL Lean Six Sigma Green Belt. From UniKL MyTech, Johor Bahru in 2016, and her involvement in research project activities with 8 publications, reports, bulletins, 5 modules, and 6 manuscripts. Let us welcome Dr. Munyamal Krishnan in the usual way. So, ready when you are? Okay, our panelists, everyone ready? Macam nak bertanding berperang pula kan? So, we're going to do it sesantai yang mungkin. It's just a discussion from 4 newly met friends here at the front. And everybody is welcome to join us or just maybe share some question or experiences with us as well for the discussion. So, the first question we'll give to Dr. Alex. How do you measure the impact of lean initiatives on patient outcomes and satisfactions, and what key metrics do you track?
Thank you very much, Sister Emma, for the kind introduction. I'm honored to be surrounded by roses. I'm the thorn among the roses. I think thank you for the first question, to start the ball rolling. I think this is a very good question. Not easy, but I try to answer. Just a disclaimer, actually I'm still very superficial. I know lean very superficially. There are a lot more experts and guru among us today. So for the first questions on the metrics on lean. Generally, I think we are not lacking of data. We have a lot of data, and to put lean in the dimensions, I think I will put it in these 3 dimensions. The first dimension is on quality. Lean ultimately aims to improve quality, and secondly is to improve safety. And the third one, ultimately, by improving quality and safety, we will reduce the cost, unnecessary cost, by eliminating waste and etc. So coming to the first dimension, quality, we have a lot of metrics. We have a lot of projects on waiting time, to reduce waiting time, to measure the patient satisfaction or even patient experience. So actually, these are the metrics that we are using to measure performance of our lean, how our processes brings to patient satisfaction or even a good experience, like what Dr. Mailan shared earlier. Before and after, we see a drastic change in the experience. But I would like to bring a second perspective to this lean, because all this while we have been measuring about waiting time, bed waiting time, admission waiting time, clinic waiting time. I would like to share from another perspective, which is a second dimension. In terms of, I think Sister Imar is very interested in patient safety, and we have a lot of experts in patient safety. and among the audience, I believe a lot of experts in safety as well. So from the perspective of safety, I think the metrics is how we can bring down the errors. Because we learn from the guru, there are 8 types of ways. Downtime, the first one, D, means defect. Defect. So by reducing defect, actually, ultimately, we are actually lean our process. You know, in hospital, I'm also involved in incident reporting. Kena buat RCA, kan? Kalau ada incident report, kena buat RCA, kena present kepada boss. So we have been asking ourselves, which one is more time consuming? Are we putting our effort in prevention of the incident from happening, for example, medication error, patient fall, and etc.? By preventing it, is it more costly or more time intensive compared to the damage control? I actually did some estimate, you know, this Henrik's triangle, 1, 3, 30, and 300, 3,000. So I did an estimate, and I from the estimation, I found that actually the cost of prevention actually is much cheaper than the cost of damage control. So this error reduction is not only about incidents, but also including this rejection, specimen rejection of a radiological request. Just a sharing, in SGH, early this year we embarked in a QA project. It's not a lean project, it's a QA project on reduction of specimen rejection. You know, the percentage of specimen rejection in SGH, specifically to neonates, is as high as 13%, 13%. So we are talking about 1/6 of the specimens are rejected due to various reasons, clotted, insufficient samples, form not incomplete, etc. So I think these metrics in terms of FTQ that we learn from all the guru, I think this FTQ, if we measure it properly, and how we put in the Kaizen to reduce the errors, actually this is a very powerful lean. And of course, we are not talking about the reactive, all the incident reports, SIQ, all these are reactive. I think moving forward, in terms of safety, we are also talking about prospective. Yesterday, Dr. Aizatu, in her slide, in her lean tools, there is one tool, FMEA, failure mode effect analysis. I think all the guru, Dr. Ting, our doctors from Uni KL are all experts in this. How to apply FMEA, failure mode effect analysis. That means sebelum kejadian berlaku, we actually prospectively. So I think so safety is another part which I think there are a lot of opportunities. In addition to waiting time, in addition to tackling waiting time, you know, safety in a healthcare setting, I believe there are a lot of areas prone to errors, and by treating the errors before it happens, actually, it will bring down the cost. So I would like to bring to the third dimension. Just now I talked about quality, I talked about safety, cost. All this while we have been talking about financial cost, but actually cost is not only financial cost. There are tangible costs and intangible costs. Financial cost is under the tangible. Intangible costs, we have emotional costs, and we have reputation costs. You know, how this error would impact our organization. Yeah, actually patient experience and patient satisfaction, to a certain extent, actually it relates to their emotional cost. And of course, in another aspect, if we talk about waiting time, another cost we are talking about is the time cost. Yeah, so I think we have all these data actually. Probably our data is more to outcome indicators from our HPIA and KPI, and we are collecting a lot of data when we do a lean project, mainly on the process indicator. We want to collect more. We have a time motion study. Yeah. So I think to put it in a nutshell, I think yes, metrics, we have a lot of all these KPI, HPIA, and other data, and all this actually has a potential to be transformed into a lean project with more Kaizen. I think cukup untuk jawab soalan pertama, sister.
Yeah, I think it's really engaging, and I feel that it's really relates on what's happening around us every day, especially when you talk about cost and also emotional, whereby always patient and our clients, they always relate these two, and these two can lead to complaint lah, like they feel very emotional waiting, and they feel that they are how to say, they are coming from far, thinking of cost of transportation and such. Which brings me to the next question that we're going to give to Dr. Maizato. In what ways can lean practices help reduce health disparities and improve access to care for undeserved population? Yeah. Okay, thank you, Sister Irma. Okay, I think this question really close to Borneo lah. It's underserved population, but actually underserved population can be widened up into not only rural areas, but it can cover also elderly, people who are low literacy, those who work in like a blue collar workers, as well as those are poor and also probably with special needs. So this underserved population, if we look in a lean perspective, lean can really have impact to them, because what we propose with lean is really into patient care and also respect of people. Okay, so when you plan for lean, do for some Kaizen, it usually have to be patient-centered. So you have to have input from patient, you have to gather information what the patient really needs, not only for the cause of the disease, but you have to look at the patient as a whole. So I think kalau di Sabah or Sarawak, this aspect is more, I can see it's deeper in your healthcare providers lah. You really look into the perspective, like the patient has to travel far, the patient has to put up some money to come to the hospital that is far from their home. So if you look at the bigger picture, for example, we embedded cluster initiative, and if you couple cluster initiative with lean initiative, then you can have a very robust as well as very effective referral system. And now we are implementing cluster with not only in hospital as well as in primary care. So that is when you can incorporate lean principle in your referral and also in the care plan for the patients. So for example, that we do projects for reduction of time, that will be beneficial for people, for elderly, that they can't wait longer in the hospital, in the clinic, and then in terms of holistic approach, in terms of cost, the better referrals, patient won't have to come repeatedly to the hospital or clinics, so that this one will be beneficial for them. And then another one, if we can consider technology in lean perspective. So I think yesterday Dr. Mazan already mentioned a lot on technology or digitalization. So technology, if you use in a lean principle, will really benefit the total patient care journey as a whole. So in a rural area, for example, I think the concept of telemedicine has already introduced in our healthcare system, but probably it is not being utilized very much. But if you see telemedicine is basically for you to be able to approach patient that is in a remote area better than having them to come or you have to visit them frequently. But when you incorporate telemedicine together with AI, then you not only we can simplify on how to diagnose the patient at the remote area, but as well as the care plan will be very accurate as well as effective. So I think in the context of Lean for underserved patient, there's a lot that we can do to help and to make sure that this inequity is can be upheld or can be balanced up lah. Okay, is that answering your question? Actually, very much because as Dr. Maizatu mentioned, it's really close to what we have in Borneo here, where people have to travel, like they're going to sacrifice their time. People, if they are working, they're also sacrificing their work just to go to our healthcare centers, and also they have to berkorban. They don't go to work. They don't do whatever they do for their earnings just because they want to sit for healthcare. That's why when they come to our centers, when they feel something that doesn't satisfy them, so they will become a problem there, and the client satisfaction will be, of course, we're going to be affected lah in that way. Hello, Dr. Muni. I think I just met you today. I think I met you yesterday, but we haven't got a chance to talk actually. But today, I'm going to give you this question. What specific Lean tools have you found most effective in enhancing patient experience? And can you share a success story from your organization?
Thank you, sister. Selamat sejahtera semua. So today is santai-santai, right? So I just share. For me, we have around 600 plus tools, right? So, but during our training, we just teach like few for our participants, not everything. Okay. So for us, when we teach, I always say value stream mapping is blueprint for our Lean healthcare, because from the VSM, from the value stream mapping is where we can see the flow of the patient, where the patient are going, how's the flow, where's the bottlenecks, where's the patient experience the long waiting time. So from that value stream mapping is we can use the other tools like RCA and Kaizen, how we can get Kaizen or idea for improvement, how to. So for me, VSM is the good tool for us to see the patient flow. So when and during the VSM development and during the Lean training, all the staff or the process owners who involved in the patient journey in that specific hospital should be there, because not one staff can do the whole patient journey. So whoever involved in the patient journey, the staff should be there to develop a full blueprint of the patient journey. So from there we know where the patient having the long waiting time and all. It's really help us to identify and to help to shorten the waiting time for our patient. And so VSM is that. So from there we can use other tools lah to identify what we can do, what is the obstacles the staff going through. Yes, the waiting time is long, but we need to identify why the waiting time is low. So we want to identify, is it because of man error, machine error, or both? So from there we do RCA, manpower, environment, machine and all. So from there we identify more. So we ask 5 whys. Why? Why is it late? Why the staff is not enough? So from there, so the main aim is we are not going to blame anyone. Okay, we identify why the error is happening. Is the staff not enough training? The machine having some error? So from there, we could help the staff, not only the patient, even the staff also get benefit from this. So we are from research institute. We are not dealing with patient, but Lean is not only applicable in patient. Also, wherever the process is there, so during our national medical registry for projects, which is in NIH also. We did training for them because the NMR system is divided into two, where we register our projects, where we get our medical ethics, and where we get our grant. So normally it's very long. So we give training to them. Then after, even the system also a bit not user friendly. So after this lean training, they already improved their workflow, which is much more easier for us because we are using the system to register our projects. So now it's much more easier, and they already developed a new system for NMR system. So if you want to enter the NMR system for NIH, yes, it's much more easier, and even the notification are much more faster compared to this. If before this, we won't receive the notification. We have to call the staff, the officer, is it my project is uploaded, is it okay? And then sometimes it's not uploaded properly, we don't know. So we have to we are waiting for very long, then we call, oh, the thing was not uploaded properly. So that, but now it's already done now. It's from our side. But we also train hospitals. So there are a few hospitals that we are actually amazed when we saw their innovations, actually. So the most is, until now that I can remember, is Keningau Hospital now. So it's like, I don't know, that it's like a culture in the hospital, even in 2017 and 18, even from top level, from Pengara until PPK, it's being their culture to implement Lean. We saw so many innovations in them, which doesn't cost any money. Like Pengara, whenever Pengara is free, that time is, I really want to say his name, Dr. Rizwan. He liked to go around the hospital to search any asset which can be usable. So he brought the TV. TV is the old model, but it's still usable, still can use. So he brought the TV to put in patient waiting area, to run the medical CMEs, videos and all. And then they normally, they face the congestion in JPL, Jabatan Pesakit Luar. So we went to the second Gemba. They have some innovation. So we asked what is the innovation. They changed the QMS system. They have 10 rooms. 10 rooms. And normally the patient is like, they get the number and need to wait for the rooms to call their number, right? So sometimes if the room is late, their number will be called be late. So they come with the innovation. Each room is labeled with 1, 2, 3, 4 and until 10. And when the patient came, the QMS number starts with 1 and 2, 3, 4, 8. So it will be like 10 patients, go to 10 rooms, another one, the next one will start from first. So in case, let's say room number 1, the patient is there for very long, there will be a runner who check in which room is running late. So that patient, the waiting patient will be diverted to other rooms so that the waiting is not too long. So we asked, okay, how do you did the QMS system? Of course, right, it's a QMS system which you need to, did you bought the system or not? No, it was modified by a MA Sajuri. Okay, then I asked, how you did that? I tengok YouTube je doktor. That's his answer actually. Okay, that's one. And then another one, counter bayaran. Before that, the counter. Okay, so they want to have a cover by glass. They just use the DIY, their own. They come during weekend, they bought the things, they already identify how to do that and all. YouTube again, so they did it on their own. Yang tu. And then another one, this one memang very amazing lah, it's done by PPK. Blood film malaria test tu kan? Okay, they already put in the slide. They need to wait the slide to kering dulu. Then only they can send to the lab. So it will take, the PPK said normally before this it will take at least 10 minutes to kering. Kalau tak letak dalam bag, memang dikena, yes, it will be spoiled. There is a defect. So need to wait for 10 minutes. The water have to wait for 10 minutes. So he thought, I want to keringkan the thing first. Cepat so that I can hantar to my. So what he he went to the store. He saw other CPU lama-lama, which is not usable, cannot use anymore. He took the fan, okay, used like a box, glass box, but can open, and both sides he put the fan, he connect with the electric. So kalau ada 10 or how many slides, he'll put the slides inside, he'll close it, dia run lah. The fan will be running, and within like 2 to 3 minutes, the slide will be dry and can send to the lab asap. Okay, it's like maze. I saw like until now I can remember that, because when I saw their innovations, like, oh my god, they just use whatever they have.
We shout out to Hospital Keningau. Anybody from Hospital Keningau here? Dr. Isu, you feel proud with it? They can sama. Of course, always proud of that.
They can sama.
Yeah, they can sama.
Okay. We went there like few times. Each time we go there, we could find like, oh my god, so much they did. Then after the COVID, we couldn't make it anymore. But until now, it's like fresh in my mind. If asked which hospital, I will go for Keningau. Other hospitals also did their best, yes. But the fresh in mind is like Keningau lah. Yes, even like Langkawi, their blood lab is like 1 floor down. So masa tu Dr. Azlan, Dr. Azlan, what he did, if they have like, you know, like pergi kind, they just have to go down kan. So he came with that innovative, and but that one big budget lah. But because of it can improve so much of waiting time, KKM luluskan, and they managed to do that. So now it's just like they have to go down je, macam tu je, which is like 1 minute turun bawah. It's not pneumatic system, but just have to like the turunkan one like the perigi one, they just go down now. So much innovation. Like Ishtar, their lead hospital, which was certified by NPC 2 years back, they also did so much innovation. Yes, they have a pneumatic system. We went to the pneumatic room. We can see how the thing moving and all. And they have their lead team where they have specific room, and they will discuss, and they write here, whoever enter here, leave your shoe behind. In this room, all are same. So they are feel free to discuss any ideas there. So it's quite impressive lah. Okay, thank you.
Wow, that was so inspiring. I'm sure everybody here is inspired. I know I am. I'm inspired. Maybe going back, my matrons are there. So matron, we are going to do our own innovation. Yeah, matron probably put her thumbs up like that. Okay. We're really inspired. So there goes our first round of questions for our panelists. So bear in mind, actually, the panelists is not just us here in front. Everybody here is also our panelists here. So feel free if you maybe wanted to like interact or wanted to ask questions or maybe some sharings. I know just now Dr. Izul was really boasting when he mentioned about Hospital Keningau. He's really proud of it, and we are really applauding this hospital who's doing a very good job in innovation and healthcare and clean healthcare. So now we are still here in our forum for our Borneo Lean Healthcare Conference here in Miri. We are here in Pustakaan Negeri Sarawak Miri Auditorium. So we are now going into the second round of questions for the panelists. Are we all ready? Yeah. The first round already okay. Second round warm up already. That is only just a warm up. So the next question. Bawah tak ada soalan. We will open question after this. Yeah, after the second round we will open question. Then we see how. Lepas ni bertupi-tupi kita kena Dr. Mai. Okay, for the second round, the first one will be for Dr. Alex. Taichi Ono of Toyota, the originator of Lean Principles, has described 7 areas of waste that occur in every industry. Toyota leaders identified the 8 waste, and it may seem counterintuitive to apply what has worked in manufacturing in the hospital setting. So Dr. Alex, what challenges have you encountered when integrating Lean Principles into patient-centered care, and how have you addressed these obstacles? You look so serious. Is that question so...
Yeah, I was looking at the question. Hey, is it the same question?
Yeah.
Oh, okay, it's the same question.
It's the same question. I just put a bit spicy.
No, actually, my mind is still with Dr. Muni, I was thinking how I can use YouTube and also ChatGPT from Dr. Haji Masan, how I can use YouTube and ChatGPT to make a rocket. Now YouTube and ChatGPT can do everything.
I want to just share a bit before you answer that. ChatGPT also helps me in doing my MC text. To tell you the truth. Yeah, I'm having headache when Dr. Kamaru asked me to become the moderator and he gives me question. Oh my God, I said I have to study this. So what I do, I actually ask from help from ChatGPT. That's why when yesterday Dr. Haji Mazlan was talking about it, I was like smiling till my ears down there when thinking about what I've done with ChatGPT as well. Yeah. Okay, back to you, Dr. Alex.
Okay, yeah, back to the question. So what's the question again? Okay, patient-centered care. I think this is a very, very interesting to actually integrate or link patient-centered care with Lean. We have been talking about patient-centered care, and I had the opportunity to visit a Japan hospital in Kurome, in Kyushu. They even had you see PCCH everywhere. PCCH means patient-centered care hospital. So, that they even integrate, but I think that their culture is different. Japan culture and our culture, we still have a long way to go. I think just make it more santai. I share story in SGH that maybe Dr. Nazila from HKL can relate. SGH is a state hospital. We are providing 82 specialty and subspecialty services. So, when we are getting more and more specialization, we have a lot of subspecialization. It comes with a cost. Specialization comes with a cost of more and more silo. I think Dr. Jessie is nodding her head from like a hospital. When you even have more and more subspecialization, then other silo into. And Lean is about breaking the silo, you see. So the story I wanted to share here is, a polytrauma patient. Sometimes we have polytrauma patient coming to a hospital, ED. Yeah, we have neurosurgeon, general surgery, orthopedics, and etc. So Team A come to see this patient, check up. Okay, this one, post-conservative management. Team B datang, okay, pagi plan, then cabut. Team C datang, then at the end of the day, ED, they are scratching their head. So who is the primary team? Who is the owner? So I think maybe those from a state hospital or the specialist hospital, probably you can relate this problem. And I think this is exactly what we are talking about, patient-centered care. Unfortunately, to a certain extent, we are running in a provider-centered care. Our P is not patient but provider. So we are thinking about us. We are thinking about, okay, we are busy, there are all sorts of excuses to say, okay, tidak dapat turun. So how to tackle that? Actually, I know most of the hospitals, I believe, we are doing this MDT, multidisciplinary team discussion. So we are encouraging the team, instead of silo, come one by one, satu team body plan, we get all of them, we get our EP to coordinate, our emergency physician to coordinate, we get the teams, come down face to face right in front of the patient, discuss right in front of the patient and come up with a plan. What is a plan? So I think that is one way that, how we can break the silo and really achieve what we want to, the idea of patient-centered care. Yeah, I think this is one example that that crossed my mind, and that I believe there are even more examples. For outpatient setting, another story I can share is our plastic surgery clinic at SGH. It's actually at another building. Our specialist clinic is in this building, then plastic surgery is about 200-300 meters away, quite far away. So previously, they have to come to our one-stop counter, do the payment, then baru pergi another building. So this is not friendly at all. And the team is creative enough to think of another solution, which is to have a cashless payment using a debit or credit card, so they can pay at the clinic itself. So that actually facilitate the patient and family members how they no need to go through the hassle of going to another building, bayar dulu, then baru pergi clinic. They can go straight to the clinic and make the payment there. Coming to the second part of your question, what are the obstacles? Yeah, what are the obstacles? So for the first scenario, not the first story that I shared with you on the MDT for getting all the teams to come to emergency department. The obstacles is doctor, they will give all sort of reasons. Busy lah, this and that. They cannot make it. Yeah. So to put the foot down, we say, hey look, we make it a KPI. We monitor, we are starting to monitoring. Step case and fits this criteria, we make it a KPI. Then somebody is monitoring. We are monitoring what is the response time, how long the team, come. Ultimately, how long it takes to make a decision. Pernah berlaku, 6 to 8 hours or half a day, langsung tak ada decision. No primary team. Yeah, I think sister, you can relate. Maybe it happens
always,
in
like
hospital.
Every hospital has bed management unit, right? Many hospitals also have our BMU where always have a headache in that area, especially during night time, weekends.
Right.
Yeah.
And I think bed management also, we have the problem of getting a decision of who is a primary team. So to overcome that, I think the first is we make them feel the pain. We make them feel the pain. So when we set a KPI, set it as a KPI, kalau tidak capai when there's SIQ, somebody have to answer. Yeah. And of course, another things that I can share is like incident report kan. Incident report. Sometimes orang yang terlibat dalam incident, dia someone involved in incident, but somebody else is doing the RCA report. So they don't feel the pain. So certain departments, what they do is, if you are involved in the incident, you terlibat in the RCA report. So when they are involved, when they are the one who is, when they feel the pain, they share the empathy, then something could be improved. Yeah, and I think ultimately is the leadership. Ultimately, leadership must buy in. We must get our leaders, our HOD, our leaders, managers, our matron, sister, the leadership buy in first. Yeah. When the leader buy the idea, then the team will work on that. I see a very successful story. One of the very successful story, I think Dr. Myla, she spearhead the project, under her leadership. Then everyone sees, that they follow they share the same vision. Yeah. Thank you.
Yeah, thank you, Dr. Alex. Yeah, it's really ringing lots of bells there, but especially the bed management part. As us nurses, we always have the headache on that part. We have the team from bed management unit, also from SGH here of us. Give them a round of applause. I think that's not the Alex was mentioning them, right? Yeah, it's funny about that. So yeah, so the next question that we're going to give to Dr. Maizatul. In order to provide compassionate care, it is important to actively listen to patients and their families, not only hearing what they say, but also understanding their emotions and unsaid concerns. It involves being open-minded, addressing any uncertainty and enumerating their top priorities. So Dr. Maizatul, how can healthcare organizations ensure that LIM initiatives do not compromise the empathetic, compassionate aspect of patients' care?
Thank you, sister. But before that, I nak echo apa yang Dr. Alex cakap tadi on the KPIs. In the ministry, also we have headache to set up KPIs for LIM. So sekarang ni tinggal only one KPI that we maintain, that is bed waiting time. That bed waiting time pun kita just ada issue on where to start, because that is the problem, the primary team. Because ada setengah practice that the primary team is the one who decide to admit, but there's another setting the ED yang decide, then primary team has to review and then follow up with all the investigation before they can send up the patient to the ward. So memang that is one of the big challenge lah. If they can do like the multidisciplinary discussion team and everything, they come up together and decide and on the admission, I think it will make things easier lah for bed management as well as ED as well as other department untuk linkkan the process of admitting the patient. So ini pun this year I need to revise back the KPI because there's permintaan. The KPI is going down. So the date that the patients is coming more to the hospitals, we cannot cope. But actually, why you cannot cope? Probably you do not do lean that much. Okay, coming back to the question. Of course, memang lean kan kita dah tahu the two aspect is continuous improvement and respect for people. So like tadi Dr. Alice commented on metrics to how to get the patient satisfaction and everything. So that patient satisfaction or feedback can always be incorporated in your lean processes. Okay, mungkin you cannot get a positive feedback. Sometimes complaint also you can look at as a way on how patient nak bagi tahu that this is not suit their preference lah. So patient-centered care, another concept that is now popular is person-centered care. Not only kita fokus on the journey of treating the patient, tapi we look at the patient from the social background and everything. So this is the thing that you need to really look into on how to make the empathy, compassionate are embedded in your process. Okay, lagi satu is kalau let's say lah, tadi kita kata pasal teknologi. I recognize ada banyak tempat when we want to lean the process, we introduce technology. For example, we don't want patient to beratur and to register, we introduce kiosk to register. But pernah tak you pergi kiosk and you fed up untuk isi the kiosk punya requirement? Nak isi nama, alamat, salah type lagi back balik. Is that lean? No, it's not. So basically you have to have human touch in your technology. So itu maksudnya kalau macam let's say lah, macam we are in medical development division, we develop medical program information system. So memang every time we try to get feedback from our pegawai in charge dekat bawah on how we can help them to lean dia punya proses, sebab they have to think on how to put up manual processes into the IT system. But we want them to be to rasa senang untuk guna the system. That is our customer is basically the pegawai lah. But actually kalau di bawah, when we want to implement the system to our external customer, that is our patient or other customer in the hospital, so that is one thing that we have to look in that lah. So sebelum ni, kalau in the beginning of Lean, when we introduce Lean itself, kita ada perkenalkan satu kursus, nama dia Design Thinking. So Design Thinking is when you put empathy in your Kaizen. So kita tak buat gambar just for the sake of we want to know the process, but actually that gambar is for you to feel macam mana the patient go through all the journey. You have to put yourself in the patient's shoes, baru you boleh faham what is it all about for them. Just this one to prevent from the patient feel that they become the product of the process lah. Basically, that is one thing. And I tak rasa another aspect of empathy, compassionate is just to focus on patient, but we have to focus on our staff juga. Kalau staff kita stress, kalau staff kita rasa macam tak cukup rehat, do you think that they can provide good service? Do you think that they can have empathy untuk patient? Dia sendiri stress, tak ada orang pun empathy pada dia. So that is one thing that leaders ataupun top management need to see. dalam satu aspek that you want to have continuous improvement, you have to have lean, you push your staff buat lean and everything, you stretch them out. Sebenarnya kalau you buat lean, actually you tak stretch, you sepatutnya lebih menyenangkan. But it happens that probably memang kita pun agak kekangan. So you have to make sure that your staff tak rasa terbeban lah. Because when your staff feel burdened, they cannot give their wholehearted service delivery to your patient. Mesti dia akan rasa muka masam, dia akan garang, walaupun dia nak cepat because dia nak buat ni, nak capai KPI lagi. So staff is one of the important aspect untuk to ensure that the process still can can have empathy and compassion to the patient itself, that is our customer. I think that is my view. Okay.
Yeah, thank you, Dr. Mai. Yeah, I think I really agree on that, especially about the staff punya part tu, whereby happy staff, happy organisation, right? Yeah, and also like Dr. Maila also the sharing just now, kan, the staff really dedicated themselves, betul-betul want to support. The thing is from the leaders lah actually. So leaders sets the examples. So you can say it like that. Okay, moving on. We're going back to Dr. Muni. Okay, Dr. Muni, digital leads achieves gains with technologies like automated data collection, analytic platforms, digital dashboards, artificial intelligence, and integrated workflow systems. It amplifies both the measurable performance and qualitative employee engagement gains. Looking ahead, what are the innovative approaches or technologies do you foresee enhancing the synergy between lean practices and patient-centered care?
Thank you, sister. Okay, I just want to say something lah, macam tadi Dr. Alex katakan, no primary team want to take care. Yeah, I pernah encounter lah, bukan as a patient, as a houseman. Patient is lying there, one team by one team datang, okay, siapa nak pilih, bukan saya pilih kes. Saya tak nak, bukan saya pilih kes. And then region of the, part of the body pun dia mainkan peranan bawah lutut dia punya, atas lutut dia punya, tangan dia punya, atas perut dia punya jari yang bukan dia punya. So yang PT tu patient lah, kesian. Macam doktor nak pergi ke, ini bukan my punya kes. No. Oh ya ke, okay, next one. Ini yang punya kes, kenapa dia tak nak pergi? Tapi yang line down patient tu macam muka dia macam, siapa nak pergi? Saya ni, saya nak kena admit ke tak ni? Like that. But end up, they always say kat hospital, always yang kalah tu medical team. Yang kalah tu medical. Sebab tu medical selalu congested. Because kalau orang lain reject pun medical baik hati, dia nak admit je. Tak apalah, tak
Can we see anybody from medical here? Can say yes to that? Anybody medical? Yeah. Everybody was like, yeah, medical.
Yeah. Yeah, actually you're baik hati lah, accept kan. Then my specialist used to say, tak apa, selalunya medical akan kalah. Tak apa, so okay, kita accept je. Tapi saya kesian kan, patient tunggu lama dalam aircon tu, dalam sakit, tak ada orang nak admit, macam semua orang reject my case kan, macam penyakit berjangkit pula, tak ada orang nak accept I. Okay, that one. And then so about the question, the innovative, okay, the era is getting modern. Yes, I agree that we have so much of innovations that we can do, like ChatGPT lah, AI, yes, but some of our public hospitals are still manual. So some digital things are still cannot be implemented there. They are still writing manually the case report and all, right?
Especially where their staff are like the boomers, like they don't really know how to do technologies.
Yes.
Yeah, they still have that.
So we still have that kind of hospital. So the hospitals which can use the technology, yes, they are coming with, like, they already have his system, and just now while talking to Dr. Mai, he said the new system is on the way, yeah, preparing and all, yes. IT hospitals, yes, they can do that. They like cluster hospital also is one of the innovative also. Okay, they are sharing the resources and all. Okay, and just now Dr. Alex said about the multidisciplinary care. Actually, it's coming under collaborative care model. Okay, where the multidiscipline is taking care of one patient. Okay, other than that, Dr. Mai also already said about the telemedicine and all, where digital and technologies. Okay, digital health technologies, it may reduce patients who are coming to the hospital. They can get their information, or they can get their nearest hospital information, what is the queue, like overseas, yes, they already have this. When they are going, they can see online, in this hospital, what is the waiting time. So it might give them the choice where they can go. But our country is not yet. Maybe in future, yes, we can come. Okay. Then, we already have staggered time appointment here. Most of the hospital is implementing the staggered time appointment, where not 100 patients coming at 8 a.m. We already divide them according to the demand. Okay, so morning is like 20, then 20. So the congestion can be reduced, the waiting time also can be reduced. Okay, it's all the doable thing that we can do. Okay, if technology, as I said, telemedicine might help, and then collaborative care model. Okay, and then patient flow management. Patient flow management, staff able to analyze according to the flow of the patient, how to arrange them in the appointment, and how the patient flow can be managed, even the admission. So the patient flow management also can be included. One of the tools can be BMU in the admission. So BMU, some hospital, they have the IT system, but some hospital, they are still doing the Google Sheet, or they are still writing on the board. So we have to think both sides, because our hospitals are not all IT. So we think both sides lah. Not technology, it can be doable, but in our country, is still some hospitals are don't have the internet facilities. If you go to like Sarike before and all, I don't think so. They have the IT system, right? Okay. Some hospital, okay. I like to bring again Keningau. Like Keningau, they are not IT hospital. So to fasten the radiological things, they have intranet. So the IT hospital, they come up with their own system where they don't need to print anymore their X-ray. Okay, they can be uploaded on system, and the doctors can review in their handphone. Okay, because they don't have a computer, so they only can review by their handphone. It helps. But after that, Keningau already shared the system with other hospitals like Tenom before and all. As I know, they shared the IT. Betul kan, Dr. Hazel? Yes. They replicate the thing and they share with other hospitals. Yes. So some technologies still can doable. Okay. Other than that, IT like lab also not all the hospitals is IT. If IT is much more faster, yes, I agree, because the lab, they already have the lab system in the system, radiological very fast. When they done their radiological done with the lab, within like half an hour it's already uploaded in the system so that the doctors can review on the system. But we have to think about the non-IT hospitals. They still not manage to do that. So in that kind of hospitals, this kind of small innovations are very important, like what Keningau did. That kind of systems, if they can have it in the hospital, it will be very helpful. So normally they ask where we should go to get that kind of system. Always approach your IT staff in your hospital. Not only IT, even as I said just now the PPK can develop a driving system, right? Some of your staff might have the talent. Just ask them. That's why when you do the VSM, when you identify the area for improvement, when all of you sit down, get their advice. Maybe some of them can come up with, maybe I can do. Yes. Some of the hospital, not even the IT did that. Normal staff can do also. Even yesterday, we had one poster, digitalization of their radiological. The way they did is not IT sangat. They scan and they upload. Okay, that's one of the way juga. Okay, whatever innovative that can make the patient's journey easier is doable. But always think, the main aim of leave is not to satisfy our patient only. Even the staff, we don't want the staff to get stressed by, oh, I need to do leave. No. The main aim of leave is to senangkan both our life. Okay, so recently we have our lean sustainability projects. So we interviewed few doctors and staff. So when we asked why it's not sustainable, they said kegangan kerja pun dah banyak. So we have not protected time to implement lean. Okay, so we don't want that. We don't want to stress our staff to do lean to make our patient. Kalau staff tak happy, memang patient tak akan happy pun. Okay? Okay. So and then another innovative things also like appointment system. Okay. Sometimes patient discharge dari ward, kita kena call klinik dan pakai appointment, which is very long. Sometimes bukan staff tu tak nak ambil telefon because the staff is not near the phone pun. Dia pergi raya-raya, runner pergi runner, check the patients and all. So kita call 100 kali pun dia tak angkat. So some hospital what they did, they have the Google Sheet, okay. They just have PC, okay, but they only have few slots for that one day. So kalau slot tu dah penuh, dia tak boleh tambah kolom tu. Okay, dia kalau kena tambah, let's say it's urgent, dia kena discuss with the specialist or consultant baru boleh tambah. Okay, kalau tak, kalau slot tu dah habis, dia kena pergi ke next slot, which is much more easier, no need to contact the clinic staff ke anything. Okay, other than that, electronic health registration optimization pun boleh, yeah, yang tu lagi senang, so that when we did electronic system, it can eliminate the redundant registration. Yeah, sometimes IT, kalau tak dapat cari kad, register satu lagi. Kalau tak dapat cari, satu lagi. Okay, but in electronic, it can be eliminated. Okay, kalau patient dah datang sekali, all the system, all the information of the patient is in the system. So next time bila patient datang tu, kita tak payahlah pergi cari kad. Okay, so when we enter the patient IC, semua dah keluar. It's more easier. So in that way lah, the innovative can help more actually.
Right, thank you, Dr. Muni. Yeah, I think we all agree that these technologies that we have now really helps a lot. Especially the most simple thing that everybody have, I think, is now we have WhatsApp. We have WhatsApp group, whereby in my hospital, even we have this bed management unit WhatsApp group, whereby we always just update there. Everybody will orang akan lebih cepat tengok WhatsApp daripada dengar telefon berbunyi. Like people can ring the red zone atau the yellow zone so many times, and then in the WhatsApp group kita just tanya, what happened? Yellow zone, nobody pick up the phone. People instantly, like responding to the message in the WhatsApp group, then only go and check, oh rupa-rupanya telefon dekat yellow zone tu tadi tak letak betul, something like that. So it really helps lah. It really helps a lot in terms of communication. So yeah, there you have it. We already completed the 2 rounds of questions with our panelists. So how are we doing so far? Still okay? Time's up, is it? How about it, Dr. Kamaru? We still have time for another round, or maybe we can just open with the floor? Yeah, I think we open to the floor. Yeah, I think few of them are picking up their hands. Yeah, Dr. Nizam. Yeah. Can move to the front, get the mic for him.
Thank you.
Kena pakai mic, nanti orang dekat YouTube tu tak dengar suara doktor.
Oh ya ke? Okay.
Testing.
Yeah.
One question. Basically, I learned. I think my principal was echo today in one of the lecture. Or say that lean doesn't mean cut off the human resource and cut off the budget. That's I always emphasize when I'm taking care of hospital about 1 year ago. So my question is it lean cost the ministry a lot rather than reduce the expenses? Because when I want to do lean, I look at my OT time for my staff and the equipment that I need to buy is way much more rather than practice traditional way. I think to Dr. Maizatu lah.
Yeah, I was thinking that too. I was looking at Dr. Maizatu with that question. Everybody's looking at her. Yeah, Dr. Mai, your thoughts?
Maybe kalau Dr. Nizam boleh elaborate on how your lean project has made kena beli banyak lagi
More costly. Okay, want to elaborate some more?
In a minute sebelum Dr. Nizam cakap tu apa, because memang masa awal-awal kita implement lean, there's a sikit budget yang injected lah to start on the initiative because we need to do training. Allocated budget yang khusus lah untuk lean after 2016. So sepatutnya whatever improvement is in the operational punya ni lah. Okay, Dr. Nizam.
Okay, for example, we started with the portal service, PPK portal service. I started to realize that with not enough manpower, I cannot do in my portal service. How can to practice 5 personnel into make the lean works lah. So I end up putting more person and it works nice, but looking back I need to give at least another 5% OT for it make it works nicely. And the patient was very happy, the department also very happy. So at the level of specialist encounter, currently I'm looking to have a kiosk that at early stage is much investment, but looking of I can reduce almost 70% of manpower at the counter. So I'm looking back when they said my staff was saying, "Doctor, this is too much investment, too many money." But I said, "Don't worry, we still have a lot of money. What we need is just show them how efficient is our system and what benefit they can get from our investment."
So I guess mungkin in the context of tadi yang portal lah, for example. So yes, I agree that lean you shouldn't add on resource lah to your process. But that again, I echo apa yang dulu I punya pengarah perkembangan pernah cakap. We do lean untuk tolong simplify the process for now, but at the end of the day kita tak boleh lari daripada the need to put some kind of investment. Because kalau you belajar lean, there's macam ada quadrant yang low hanging fruit, low impact, high ada big effort, big impact, low effort, big impact. Okay, so usually lean will help you to tweak on that low effort, low impact, and low effort, high impact. That is all the costs yang very low cost punya lah. But when you do brainstorming on Kaizen, there will always be Kaizen yang high impact, high effort, in which your cost will be high. Okay, kalau dari segi macam you punya proses tadi you kena tambah porter, I'm sure memang kalau you bagi macam mana pun your shift hour ke apa-apa ke, that 5% is not enough lah. Okay, and I'm sorry that situation happened to you, so you need to add on. Memang we have to realise, because if I am suggesting for hospital tanpa pakar to have rotation in ED, I also have to think of how minimum MO should be dekat situ. So if there is not enough MO, I have to fork out MO lah for that hospital untuk membenarkan that ED or that hospital to run on ED tu dalam shift. Dan kalau boleh ED dengan medical ataupun ED and general ward tu kita divide on 2 pool dekat hospital tanpa pakar. So basically, walaupun you buat lean, there's always ada sedikit skeletal resource yang you need. Okay, kalau memang dah tak cukup sangat tu, unfortunately you kena juga tambah. Lagi satu, in terms of the second one is on tadi lah kan your IT and your system sama jugalah, because kalau we look at that high impact, high effort banyak hospital memang propose to MOH on digitalization. Tak boleh lari lah, automation, digitalization. Memang it will help us to reduce our human resource lah. Memang dari segi administrative management ataupun processes will be much helpful. Kita tak akan guna lebih banyak orang, and more of our staff can spend more time on clinical aspect ataupun patient care. But the cost is very high to implement digitalization, the automation. So whatever that we are trying to perkenalkan di bawah, macam as smallest system as possible yang kita boleh introduce, we bagi. As cheapest as we can bagi, we bagi. So macam for example sekarang we use interim information system MPIS for hospital. I don't know, kalau you tengok sistem tu nampak macam very cheap. Dia punya muka depan pun tak cantik kan. Tapi you can survive with that, okay? You can survive with that sementara KKM come out with the bigger digitalization yang memang costly for the KKM. KKM tak ada duit ya. Duit bukan kita punya, it's MOF punya. Apa-apa mak kita bagi tu kita terima seadanya. But macam KKM pun kita bagi banyak anak-anak kita, bukan setakat hospital, kita ada klinik kesihatan yang lebih daif daripada hospital. Kita ada pergigian, kita ada banyak lagi program. So that big chunk, that big cake, so kita kena bagi kecil-kecil to all kita punya anak-anak lah. So I hope that macam boleh be patient, but we in Ministry of Health memang akan terima whatever that your suggestion untuk that high impact, high effort. Kita akan sedaya upaya fulfill. Macam contohnya your bed management, your short stay, kalau you tak ada facility, kita akan cuba think of ways to accommodate lah. Okay, walaupun you akan rasa macam dah tarik kanan, dah tarik kiri punya kain lah basically, but that is what we have to do in order for us to survive and sustain our service. Okay.
Yeah, thank you, Dr. Mai. I think that answers the question. Dr. Nizam from Hospital Sibu. Yeah, I think I nak buka lagi another round of question, but master mencemburui kita. Like time is always our enemy here. So I think we will just conclude, give a bit of conclusion by me. With that final round of question and sharing from our panelists, I think it is time for me to try to conclude our discussion today, if I may. Just a simple conclusion. To begin with, the discussion today highlights the importance of adopting patient-centered lean cultures and practices. Everything, we hope that this session has enhanced awareness among healthcare professionals about lean initiatives and the potential of innovative approaches or technologies. On top of that, we understand that healthcare professionals play a crucial role in delivering exceptional care to patients, ensuring the highest standards of quality in their services. And last is, we are now more informed and engaged on how applying lean principles in healthcare organizations can streamline operations, reduce waiting times, and enhance communication, ultimately leading to better patient experiences. Ladies and gentlemen, there you have it. With those conclusions, we are wrapping up our forum session of today. On behalf of all panelists, we would like again to thank you and congratulate the organizing committee for being able to organize such an informative and fruitful session today. On behalf of the organizing committee, we would like to again express our million thanks and high appreciation, especially to our distinguished panels. Give them a round of applause. Yeah, for sharing the expertise and personal experience and journey with all of us today. And last but not least, I would like to express personally my gratitude and give thanks to the organizing committee, Dr. Kamarul, for giving me this chance. And also for Dr. Jack. Actually, Dr. Jack is the one who's giving me the real chance and proposing to Dr. Kamarul. And also to the panelists for making me feel like I'm somebody here with all you guys here. And also, not really. Yeah, almost there. Getting there. Yeah, getting there. I would like to apologize for any inconvenience, mistakes, and any sorts of shortcomings from my part from the beginning until this moment and forward. Hope to see all of you again in the future. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you, everyone. So we conclude our forum session for today. Thank you also for our viewers. Rasa-rasa YouTuber Thank you also for your viewers on the YouTube channel of Nana Ube channel. So we are going to take a break for this afternoon, for a lunch break. That we're going to come back here at what time, Dr. Kamara? At 2. Ya, sekarang tak nak pukul 1 rupanya. So we're coming back here at 2 p.m. And what awaits us this afternoon is the prize giving ceremony for all the winners of the oral presentation and e-posters presentation yesterday. So be back here at 2 p.m. and we'll see you guys soon later. Bye. Thank you so much.
Okay. Yang lain boleh keluar, okay. Boleh pergi makan, dijamu selera, okay. Meanwhile, AJK, speakers, judges, juri, panelist, kita ambil gambar sekejap boleh dekat tangga. Oh sini, sinilah, boleh tak? Sinilah, okay. At the stage lah, boleh. Stage boleh.
So they only push the geriatric, the rehab cases, long stay one. Okay, see.
Boleh tolong ambil gambar.
Boleh, boleh.
Thank you. Kalau nak buat boleh juga lah. Tengok dulu doktor.
Okay.
Terima kasih doktor.
Boleh. Testing. Boleh. Okay, 1, 2, 3. Sekali lagi ya. 1, 2. Okay, freestyle. 1, 2. Okay, kejap ada satu lagi. Okay. 1, 2. Okay, boleh. Thank you.